put it in brackets, notes in the margins, basically because I'm wondering who's got like some sort of lawnmower going on outside their window.
Me, I must
Yeah,
mute.
can you
I'm
mute?
I'm
Yeah,
so sorry.
yeah. Thanks Sheila, and like, you know, just unmute yourself if you want to say something, although I think I prefer to go through without interruption and leave all the discussion till the end. I've called it notes in the margins because I'm the sort of person who, a bit like William Blake, underlines, and also, like, you know, on a typical copy of Therapy Today, you know, you'll see my scrawl saying things like "the old fool" or whatever, you know. So these are kind of notes in the margins. I wanted something more streamlined, but of course I ran out of time. So I'm subtitling this. These are really my notes in the margins that you would see in my copies of Therapy Today. Yeah. So in terms of, you know, where does it all start? You know, us becoming counsellors and psychotherapists. Of course, it starts with what you can either consider training or education, and whether you consider it a training or an education, I think will inform the future of psychotherapy. And I said there's a lot of pressure now from the big three to create a system of common education, training, and standards. Yeah. Training kind of implies that you're being taught how to deliver interventions, which very well sort of suits manualized therapies. You know, you have a protocol for dealing with depression or some kind of protocol for dealing with anxiety. And as long as you follow the steps, you're following an evidence-based therapy, and you can put that in your literature and so forth. Education, and I'm not saying these are facts, you know, people might argue, oh no, training's more than that. Yeah. Okay, it might be more than that, but these are kind of implications, not necessarily facts, I think. Education, I think, implies a level of critical thinking, which allows for professional judgments and so forth to go off manual. And in fact, you know, I think one definition of professional is really seeing that you know, the professional has the judgment to make decisions, you know, and personalized decisions, individual decisions, contextual decisions. You know, if you think of a solicitor, you're not really wanting them to kind of follow evidence-based procedures, that you're wanting them to understand your case inside and out and make very precise decisions about what they're going to do for you. And that's really like the status of a professional, is that they are given leeway. They're not meant to like follow standardized procedures, but you consult a professional because they have judgment and can discriminate. So whether you want therapy to be like a training in which you just kind of learn protocols and procedures that are evidence-based, or whether you want therapy to like come from an education which allows you to have a degree of critical thinking where you can see contextual differences and stuff, will implicate where therapy goes in the future. Another big thing that we've been just talking about in the meeting and the AGM is the barriers to inclusion within therapy, which of course everything like that has kind of got really heightened in the COVID era, especially with the death of George Floyd. And we've got Dwight Turner coming to Sussex Counselling next month, and if you can't come to that, you should at least read his book, Intersections of Privilege and Otherness in Counselling and Psychotherapy. Class is really important in therapy. Basically, one of the most obvious things, you know, that again we talked about in the AGM, is that counselling and psychotherapy tends to be a white middle-class profession. Most people need money to get going in counselling and psychotherapy. It costs, and the more qualified you are, the more it costs. So class is really important, and I'll be talking about that a bit later on. Money. So all these things around race, class, gender, sexuality, disabilities, what's being called nowadays intersectionality of different identities and representation, or not, for both therapists and clients. You know, who are the therapists and who are the clients? What kind of intersectional identities do they represent? So that links directly into, this comes, Sheila, from Liz Cotton's new report that she did for the Counsellors Together National Counsellors Day last week. And Liz Cotton did a survey of 1,265 respondents, which is quite a lot of respondents. So you could say that this is, you know, definitely quite a fair reflection of what's going on. So in her thing, over half earn less than £400 gross per week. Over half, these are counsellors and psychotherapists. Over half earn less than £400 gross a week. That could be slightly explained by this 51% work part-time. So half of us work part-time. So you wouldn't expect maybe to earn too much more than £500 a week if you're only working part-time. 63% of us are self-employed. I think that's the implications for the future, because there's a lot of, let's say, shenanigans going on in the BACP, UKCP world at the moment. And a lot of it is really based around the NHS. It's sort of like we're trying to make ourselves more attractive for the NHS. But 2/3 of us are self-employed. Are our interests being represented by these kind of machinations and so forth? Yeah. You know, and 64% of this survey were BACP members. The BACP is hugely influential. I'd say in terms of impact, it's more influential than the UKCP, the kind of body for, you know, people who identify as psychotherapists. These 30% make their main income outside counselling and psychotherapy. So 1/3 of us don't, you know, we're not counselling and psychotherapy, no matter how qualified we are, it's still not really our main job. Yeah. And then, you know, and that's reflected in that last one. 30% can't see a future earning a living as a counsellor or a psychotherapist. You know, which is quite a lot when you think about how much how much time, energy, money goes into a training, and then 1/3 of people by the end of it can't see a future in it. This one, approach is all for one and all one for all. Yeah, all approaches for everybody, or just one approach for everybody. Yeah. So I'd say that therapy is a modern phenomenon, you know, stretching from Freud to CBT nowadays, and it comes, you know, it's got quite a history. So there's definitely a future for counselling and psychotherapy. It's just what kind of future. So, you know, when did it really start? You can date it back maybe to 1859, the Boston School of Psychopathology. William James was in that, and Wampod and Immel talk about that as the epicenter of the new talk therapy. So it's got quite a long history. 1879, Wilhelm Wundt opened the first psychological clinic. 1886, Freud starts practicing and researching, and then publishes The Interpretation of Dreams in 1900. So then you've got psychoanalysis really from 1900 onwards. That's really the only kind of talking therapy. Then in the 1920s, you get behaviorism and openly disdainful of Freudian theory. 1936, you get really the first paper that sort of foreshadows the idea of integrative psychotherapy. Actually, does behaviorism have to be against psychodynamic, or psychodynamic against behavior? What if there's just common factors? So there's a therapist called Rosenzweig, and he wrote a paper, Some Implicit Common Factors in Diverse Methods of Psychotherapy. At last, the dodo said, everybody is one and all must have prizes. And that's what, you know, the first articulation really of what you might call an integrative or pluralistic position. And Rogers, you know, obviously people like really associate him with the 60s, I suppose, early 60s. But actually he was writing about non-directive therapy from the early 40s. So that's when that starts. And then leading on to Maslow and humanistic psychology and all the humanistic therapies, which of course like sort of have their heyday in the 60s and 70s. And then from that, from the humanistic thing, people begin to sort of go into more spiritual directions, and then transpersonal approaches are kind of formulated. So by the time you get to the 70s, a lot of writers identify 4 forces: first force psychodynamic, second force behavioral, third force humanistic, and fourth force transpersonal. I really like, my mentor is John Rowan. I did several trainings with him, and I love his books, and I think he's the, you know, I'm unashamedly I'm most inspired by humanistic psychologists, you know, so I suppose you might say my core is in the third force. And Rowan's sort of cry, he, you know, for the future of counselling and psychotherapy, was he believed in, you know, this acronym HEART. He thought the best therapies should be humanistic, existential, authentic, relational, and transpersonal. Okay, this is my favorite picture. I don't know if people are familiar with this. This is William Blake's Newton. Yeah, and this is it's kind of, Newton is there with his compasses measuring stuff, but it's like he's in the ocean. He's actually drowning, and he's so focused he doesn't even realize he's drowning. He doesn't realize the stuff that's all around him. He's just focused on his bit of paper and his compasses. And you know, so this is kind of, Blake completely rejected this kind of measuring culture that we've kind of all become so obsessed by, trying to put things in boxes and categories. And so this kind of split, I think, comes into the future of counselling and psychotherapy. There's a lot of people, and psychologists in particular, sort of trained to measure, create statistics, put things into boxes, categorize. And you know, if their influence of psychotherapy and counselling kind of sort of dominates, you know, then we're going to have much more of what I'll talk about later, an audit culture. Or if we see therapy as something more creative, immeasurable, can't be put into boxes, you know, then we'll kind of have a different kind of future for therapy. You know, it boils down to this science versus art, or science and art, or perhaps just art. Yeah. So Marvin Goldfried, I don't know if anyone does Twitter. I managed to avoid it until the past couple of years, and then somehow I got onto it, and then it does become quite addictive, and it's quite great. People like Marvin Goldfried will sort of you know, say what they think every now and then, and you know, quite a lot of, you know, sort of people you've actually heard of talking about stuff. And in one of his tweets, he described therapy as an infant science. Yeah, yeah, you know, a put down. But I mean, what I sort of also get from that is he's making a massive assumption that therapy is a science in the first place. You know, is it a science? Yeah. And again, there's implications for the future. You know, there are a lot of psychologists and psychotherapists and counselors who do see therapy as scientific procedure. And if, you know, and then, you know, that sometimes, you know, in the degrees, you can get a BSc, a Bachelor of Science in Psychotherapy, or you can get a Bachelor of Arts in Psychotherapy. So we're not agreed really whether it is an art or a science. And whether you believe what you're doing is scientific or not scientific, it's going to have huge implications for how you practice. And whether the powers that be think that it should be scientific or more of an art, it's going to have huge implications in terms of how they assess standards. You know, and this feeds directly into the medical model versus what you might call the humanistic existential phenomenological model. And in the medical model, I would argue that sorry, in the humanistic phenomenological model, consciousness and experience are seen as more important than standardized diagnoses, standardized treatments, and standardized cure. The medical model is basically diagnosis, treatment, cure. But they don't, so what you have is more important than who you are and what your story is. Whereas I would argue, you know, therapy at its best isn't really so bothered what your diagnosis is. It's more interested in who you are and what your experience is. Yeah. So it seems to me the medical model wants to downplay the importance of consciousness and experience of the person and focus on symptoms and illness at the expense of that, I would argue. Art Bohart, who's quite a sort of big figure in the person-centered world, distinguishes between what it calls interventionist models that sort of have basically an I-it relationship, you know, that the expert practitioner is intervening with the person and their symptom, rather than client as active self-healer models, you know, where the person, well, all you're trying to do is facilitate the person's own resources to heal themselves, you know, which he could describe, you know, that's the classical person-centered model. The client has everything he or she needs, yeah, and you know, all the therapist is doing is facilitating the resources of the person. He also characterizes it as a way that really the question what kind of active self-healer models are asking is, can I understand you? Basically, you're not saying, how can I help to the person? You're saying, can I understand you? And then really trying to deeply understand the other person. That is the side effect, is their healing, because once they feel understood, they put their own resources to work. But, you know, Art Bohart also acknowledges that the interventionist model is the dominant model. Why have we got into this mess? I'd say, like, part of the reason why we have got into this mess is because what's happened is there's this thing called evidence-based practice, which has really become a tyranny. Yeah. Why has it become a tyranny? One, because evidence-based practice isn't put into effect, even how evidence-based practice should be put into effect. In other words, the evidence-based practice comes from evidence-based medicine. And when this was first talked about, the people that talked about evidence-based medicine basically said that it should rest on 3 legs of a stool. It can be thought of as a 3-legged stool. The first leg is indeed clinical evidence. You know, you do your RCT, you find that 7 out of 10 people like CBT and 5 out of 10 people like person-centered therapy, therefore let's give everyone CBT. Yeah, but you know, that's only one evidence. The other 2 stools are, one, the clinician's expertise, yeah, and knowledge. Yeah, so just because the evidence says that CBT is really good for depression doesn't mean it should be given to everyone. What does the clinician think? That is meant to be a part of evidence-based medicine. And then also the patient context and characteristics. Yeah, yeah, things like culture. Yeah, personality. You know, some people like therapy to be very directive, and some people like therapy to be very non-directive. So actually in evidence-based medicine, you have the clinical evidence, the clinician's own thoughts on the matter, and the patient's own thoughts on the matter, or client. Yeah. And then, you know, this wise evidence-based practice has really become dominant. So, for instance, a year or 2 ago, some researchers at the BACP, they used the whole data set of IAT from the beginning. Yeah, massive. You can't imagine a more massive data set. And basically, that data set suggested that counselling was effective as CBT. Yeah. So you take that along to NICE, and they say, well, you know, it's not an RCT, it's not gold standard. So, and that's what you might call practice. So that's practice-based evidence, where practice-based evidence is from actual practice. You get people to fill in forms, and then you kind of get practice-based evidence. But that is evidence-based practice is the RCT. So, but you know, the dice are loaded, yeah. And why are they loaded? Because we're kind of living in this kind of audit culture now, basically, which is completely connected to what I call free market fundamentalism. Other people call neoliberalism. I don't call it neoliberalism because I know 90% of people don't know what neoliberalism actually means. Yeah, and it's not new and it's not liberal. Yeah, it basically means free market fundamentalism. Yeah. And that's why you've got audit cultures, because everyone's competing in markets. And so for a therapy to succeed, it has to show that it's not just effective, but also efficient, because it's all measured on the bottom line. Yeah. So there's a kind of certainty about that, is this therapy really going to be cost effective? Okay, we'll put that into practice. And, it has to be right and correct and efficient and everything. Whereas you can see therapy really as a praxis, a practical science, praxis. Aristotle, like I said, a science without a definite endpoint. So the practitioner is always in practice, therefore always learning, always making mistakes and always learning from those mistakes. So it's not like you kind of have your completely baked and efficient therapy that you then kind of deliver to people. Actually, you're dealing with a human being who's learning from their mistakes as they go along, and that, mistakes in therapy aren't something to be kind of completely shunned. And in fact, working with alliance ruptures is part of the craft of therapy. Pardon? Oh, right, okay. Then you kind of, I think as well, when we're thinking about the future of therapy. Oh, by the way, if anyone wants to, it's probably too late now, I was meant to say this at the beginning. If anyone wants to put anything in the chat room, like questions or points of discussion, I'll read them in the break, and then we can, I'll try and answer them if you want to put anything in there, as well as in the discussion. So I think what's really important is that therapy happens in different contexts. There's three major contexts. You've basically got the state public sector, mostly represented by the NHS, the private sector, and the third sector, charities and so forth. And the NHS state sector, what's brilliant about that, and I'm really glad that Katie's working in the NHS, at least some of us are, but so it's fantastic. It's free at the point of delivery. So that's brilliant. That opens up therapy to a lot of people. But there is a shadow side to that. The shadow side is the state runs it. And the state may not have the same value as counsellors and psychotherapists. It may not fit in with our values. And certainly from a humanistic therapeutic side, we're not just about making people better or unsick. We're about people fulfilling their potentials. We're not just about getting people back to work so they can keep on producing stuff and be of added value to the economy. We want people to live the best life they possibly can, which might possibly mean chucking their job in, or something, so we can sometimes have a clash of values with the state. So basically each context has different interests which don't necessarily harmonize. And then I think we kind of collectively get a bit of an inferiority complex about that. How come the state doesn't want us? How come they won't employ us as counsellors and psychotherapists? So that sort of paranoid complex, if you like, I think has seeped into our professional bodies like the BACP, and they're trying to make themselves more attractive to the state NHS context. But if we make ourselves more attractive to the state NHS context, that is going to impact the private sector and the third sector. And you kind of have to think, is that worth it? So most of us actually are in private practice. The PCU did a quick survey, and the PCU is the Psychotherapy and Counselling Union, which actually I think potentially in the future Sussex Counselling and Psychotherapy could maybe join or become part of, or maybe we could ally, but that's another conversation. But anyway, the Psychotherapy and Counselling Union membership, the self-employed number is 54%. So half of us are self-employed. Only 35% of us are employed, meaning employed by a company or whatever. And out of all the people in the Psychotherapy and Counselling Union, only 10% work for the NHS. I don't know how representative that is. So this kind of sector for counsellors and psychotherapists is actually quite small. And yet it seems as if we're bending our sort of standards and ethics to try and fit into the NHS. And what guarantee do we have that it's worth it? Just leave you with that question. Then you got the third sector, and I've put a lot of good work goes on here, but also a site of therapist exploitation with a culture of voluntary and unpaid work for qualified therapists as well as trainees. Also exploited by the NHS. A lot of cases they won't or can't deal with get shuffled off there to be dealt with by therapists who paradoxically aren't seen as good enough to be in the NHS because they don't practice IAPT-approved models. You know, it's a real kind of Alice in Wonderland kind of world.
You brought me a cuppa.
Oh, Jeannie.
Sorry.
Okay, all right. These BACP, sorry, the membership bodies. Who are our membership bodies? This is just factual stuff. We've got the BACP, UKCP, BPS, BPC, BABCP, NCS, ACC, ACP, HDI. Now, why I've put those, basically because of scope coming up, Ian. Scope, where's Ian? Yeah, okay, it's coming up, Ian, don't worry. And what I think is interesting, there's basically 7 membership bodies for counselling and psychotherapy that are trying to work out scope, which is this, I can't even remember, but it's like standards in education in counselling and psychotherapy. And if you haven't heard of it, that's something for the discussion. Yeah, I'm surprised how many counsellors and psychotherapists haven't even heard of scope. But what's interesting is the British Psychological Society have got nothing to do with scope, nothing to do with it. They don't care about it, basically because they're sort of in cahoots with the NHS and doing their own courses and training. Yeah. Also the BABCP, British Association for Behaviour and Cognitive Psychotherapies, they're not involved with scope. So it's not the be all and end all, you know, and a lot of counselling and psych, you know, I would say both of those are psychotherapy organisations. They've got nothing to do with scope. So that doesn't mean that if you're not involved with scope, you haven't got any credibility as a counsellor or a psychotherapist organisation. Yeah. And I never understand, BACP like is a hugely powerful organisation. And I just put there, they don't seem to believe in the credibility of their own standards and kite mark. They want state approval and regulation. Admittedly, this does come from the members, and I know I might be splitting opinion right here. There's a lot of people who want state regulation. They see that as the kind of answer to the problems of counselling and psychotherapy. But there's a lot that don't. So it's one of the many civil wars in counselling and psychotherapy. But BACP have kind of taken the side of the people who want statutory regulation. And I think people who want statutory regulation are also seem to be in the board. Yeah. But you know, and it may or may not happen because it is up to the government at the end of the day anyway. Okay, so if you want to get involved with therapy politics, what are the sort of organisations you can join? Like I said, there's PCU, the Psychotherapy and Counselling Union. I think this is absolutely vital. I mean, they'll help you personally. Unfortunately, it's never happened to me, or not in any serious way. Anyway, I did get one complaint. I've had 2 complaints. One for the language that I used. I was just, someone said they were beyond the fringe. And I said, so you're eccentric. That taught me to use the client's language because there's a complaint about that. And then someone who said that they, were sort of BA in psychology, I thought they could handle the fact that they might have mixed feelings about their dead father, and that didn't go down very well, and I got a complaint about that. But I mean, the complaints can be very serious, yeah? And the BACP won't protect you. So in case you get a complaint, it's absolutely vital you join the PCU, because they have put in the clause now. For a while, people would only join them once they had a complaint. But now they are bringing in common with a lot of unions, that they should be a member of the union for at least 3 months. Otherwise, you don't get the help. And the ACP, that came out last time they tried to have a go at statutory regulation, and headed up by Andrew Samuels, Alliance for Counsellors and Psychotherapists Against State Regulation is the full title. Yeah. Then you've got Barton, the Black African and Asian Therapy Network, which and if you want to kind of try and get the Dwight Turner seminar to more people, they're kind of first stop really. And then you've got the Association of Neurodivergent Therapists, Counsellors Together, UK. Their mission statement is basically to end the culture of voluntary and unpaid work. Yeah. And Surviving Work. They're great. I'll tell you, that's run by Dr. Elizabeth Cotton, who gave the did the survey about with the 1,300 therapists. And then more recently, literally just in the past month or so, the Campaign for Universal Access to Counselling and Psychotherapy, UAC. So how is all this managed in the NHS? How is this manifested in the NHS? So you've got this IAPT project. In the old days, you used to have, surgeries would just hire their own counsellors and psychotherapists. But since 2008, IAPT started. And it's a big service, 1.5 million referrals in 2019. But 2/3 of IAPT patients did not complete their treatment. It kind of fits into what they called new public management from the 1980s onwards, sort of Thatcher Reagan era. It's all driven around targets, outputs, processing people like they're, sort of on a factory conveyor belt, and as long as you sort of output them with the right PHQ and GAD score, that's all good and fine. If you want more information about that kind of thing, I can't recommend survivingwork.org highly enough. Yeah, so it started in 2008. I've already given you those 50% recovery, which is actually pretty good. 50% for alcoholism is seen as pretty good, so that's not bad. It's £1 billion spent on IAPT since its inception. That's a lot of money. But has it really improved things? Before IAPT, there was a survey done of more than 11,000 clients, and at least 5 or 6 clients out of every 10 met recovery criterion. The only difference is that the recovery was measured by core OM versus PHQ and GAD, which is sort of a standard nowadays. So I say IAPT seem to perceive counselling and psychotherapy trainings, whether 2, 3 or 4 years, as inadequate, and encourage therapists to train further in their IAPT approved therapies, which there's just 6 of them: counselling for depression, brief dynamic interpersonal therapy, and of course CBT. And they are actually recruiting actively for counsellors and psychotherapists from June of this year. Yeah. But on the proviso that you do one of their IAPT approved trainings. Yeah. So I've put here 1 year certificate PWP seem to be preferred to experienced therapists, unless those therapists are trained by the NHS. IAPT in-house qualifications. The NHS seem to be going their own way and dismissing the value of external standards and courses. Common criticisms of IAPT: overly reliant on the medical model, misleading statistics, monopolizes funding in both the public and third sectors, pseudo-scientific, evidence based on very narrow definitions of evidence, as I've explained before, especially expensive and inappropriate randomized control trials, dominated by mostly one type of therapy, CBT. A lot of support is manualized and or digitalized. Relational therapy is undervalued, if not unavailable. And lack of choice. There's only 4 or 5 IAPT approved therapies. They're not able to choose their therapeutic approach, their therapist, or the setting in which it takes place. And then in April 2021, BACP announced to some pride that they've been invited, over 10 years after the start of IAPT, to be represented on the IAPT advisory group. And the BACP is represented by Fiona Ballantyne-Dykes, who's the Chief Professional Standards Officer and Deputy Chief Executive, the most vocal and enthusiastic supporter of SCOPE. But the representation of the professions will rotate between 5 different professional organisations. So in other words, they're only there for 1 year, yeah? Then they're off for 5 years. So how much power have they really got there? Counselling, and this all boils down to, I mean, to my mind, basically the whole scope thing, the whole professionalised regulation, basically they're wanting to institutionalise a difference between counselling and psychotherapy. Psychotherapists want to be seen as, and I'm not saying all psychotherapists, not all, but the UKCP wants their psychotherapists to be seen as better and different. If you want to find out more about that, go to my blog, jbeichmanwriter.com, yeah, and I've got a blog called Counselling and Psychotherapy, What's the Difference, that kind of goes into the whole history of that. And I do notice that BACP seem to be using terms counselling and counsellors a lot more in psychotherapy and psychotherapists now. Why? My guess is that they might capitulate to the UKCP, give psychotherapists back to the UKCP, and then try and become the main representative body for counsellors and try and squash the NHS, sorry, not the NHS, NCS, National Counselling Society. I don't know, that's just a guess. So then this is all like under the sort of whole issues around professionalisation and regulation, yeah. So, and then, you know, it just keeps on coming, it keeps on coming. And so Baroness Jolly in the House of Lords, she's pushing for regulation. The rationale is that it protect the public from 1299 trained counsellors. But Jordan Dunbar, this BBC journalist, kind of did some kind of expose about these 1299 courses or whatever. And then one lord says in that debate, the BACP and the UK Council for Psychotherapy say that they would welcome statutory regulation. First I've heard of it, they're even pretending that scoped isn't about statutory regulation. They say, well, you know, if it goes through, it makes statutory regulation easier, but that's not the point of it. Do they? Have they made up their minds already? And why do they think it should be regulation? Because it's assumption that psychotherapy is a healthcare profession. Because this is a quote from the person in the debate, because the person setting themselves up to provide care and support somebody else is healthcare, and somebody doing that needs to be regulated. Yes, and then in that same debate, one of the lords, you know, said that, you know, they should be IAPT accredited. Yeah, so we're going right off the whole, you know, BACP, UKCP. You know, maybe IAPT will all sort of join IAPT and become IAPT accredited. Yes, these are just basically questions, things that you need to think about if you're talking about the future of psychotherapy and counselling. You know, do we need a knowledge base? You know, what do the employment opportunities need to be? What about manualized therapies? Do we agree with the medical model? You know, and then of course, counsellors and psychotherapists are just, there's you know, lots of psychological professions which sort of more critical academic people call the psych complex. Yeah, does regulation lead to standardization? Yeah, where does private practice fit into this? And the National Counselling Society, in their response to Scoped, said, what problem is regulation or standardization trying to fix? Is it a problem? If so, can regulation or standardization fix it? If this problem is fixed, what else gets broken? If something else is broken, is fixing the problem worth it? And they distinguish between autonomy versus process-centered practice. Autonomy practice is more things like person-centered training, where you're trying to, your own autonomy as a practitioner, the client's own autonomy as a person, versus process practice, where you're just basically delivering interventions to objects, i.e. therapy, as Bohart would describe it. And then in the end, certainly in the private, if you did get regulated, that would only really impact the NHS and the third sector. Certainly as self-employed private, you basically can just say, well, I'm not going to be regulated by you, I'm going to practice anyway, you know. So that's always an option. Yeah, so the history of these bodies, BAC, UKCP, because they wanted psychotherapists to be seen as better, and then the BPC split from the UKCP because they wanted psychoanalysts to be seen as better. And then Sally Aldridge, the great Sally Aldridge, who unfortunately doesn't have as much influence with BACP as she used to, just identifies four major splits in counselling and psychotherapy around status, you know, these ideas of A, B, and C type therapists, otherwise known as counsellors, advanced counsellors, and psychotherapists, theoretical orientations. So sometimes people think that because you're psychodynamic, you're better than any one other approach. And then voluntary versus paid, yeah, and non-professional versus professional ambitions. So the professional project is often seen as wanting to gain closure over an area of practice and have a monopoly in the end, and you can only have a monopoly if the state backs you. That's really why you would go for statutory regulation, is just so that you can monopolize a type of practice. Yeah. But then there's other people that don't want counselling and psychotherapy to be seen as professional at all, and actually just want to disseminate power and knowledge to people so that they can kind of do it for themselves. Professional Standards Authority, that's who's the main authority now in regulating the different bodies. It seems to me the BACP want to kind of leave them behind and just take over themselves, but we'll see. Okay, scoped. All right, we get there, Ian. We get there. I think I can just, I'm going to go, because I know I'm running out of time, so I am going to just sort of skip through these a bit more. But basically, it's seen as guarding against the practice of unqualified therapists. That's the smokescreen, I think. Because, apparently policymakers don't understand what we do. But is it really going to protect people? I mean, I just, I don't know if anyone else gets the PC UK, but you can just make up titles. Yeah. So for instance, I get PC UK, I can become a certified anxiety treatment professional for £125. Yeah. So if you regulate, even at best, you regulate counsellor, psychotherapist, okay, I'll become an anxiety treatment professional. Yeah. I just think the whole thing is about trying to institutionalize the difference between counselling and psychotherapy. And Liz Cotton agrees with me. She said, from an industrial relations perspective, what this looks like is that instead of protecting the thousands of highly qualified counsellors and psychotherapists from the sector-wide downgrading of clinical services and jobs, the strategy is one of ring-fencing the status of psychotherapists and letting the counsellors fight it out in the emerging realm of sub-therapy. And like I've said before, where the BBC completely out of the picture. CBT is just a type of counselling psychotherapy. And like I said, the NHS and the government don't mind confusing. They say, oh, we're going to clarify the landscape. Well, that's great, clarifying the landscape of what counsellors and psychotherapists do. But if you're going to keep on inventing loads of different titles, then how can we clear what an anxiety management consultant is and so forth? Yeah. My final view of scope is it's either too simple or not simple enough, or too complicated or not complicated enough. As I was suggesting in the AGM, that there should just be one common entrant point at which you're seen as qualified. Yeah. But what they've done is they're attempting to micromanage the precise meanings of counselling and psychotherapy, which will kind of completely change how people are trained. If they say, this is precisely what a counsellor is, and this is precisely what a psychotherapist is, everyone is going to have to jump through those hoops to get their courses accredited. May 2021, they appoint an independent chair of the Scoped Oversight Committee. And then very important, in June of this year, it's stated quite casually that whether Scoped is implemented or not will be decided by the board versus the National Counselling Society, who are going to actually ask the whole membership to democratically vote on it. Social media, there's a lot of social media things that now, like if you want to sort of get more involved with the politics of therapy and so forth, which after this talk you may not want to, but if you want to get involved, there's lots on social media. By the way, of course this slideshow can be shared. I can send it to anyone that wants it. Another exciting development in the future is psychedelic therapy. And if you want to know more about that, there's a fantastic book by Jessica Rogan called Encountering America, where you see basically it's about Esalen in the 19th, everyone who is everyone went there. Gregory Bateson, Carl Rogers, Fritz Perls, and so forth and so on, Aldous Huxley, they're all there. Yeah. And actually, if you kind of trace back the history of psychedelic therapy, it's like they were all there at Esalen. Yeah. If you want to know more about that, please go to online events where I have a talk with lots of not writing, it's all pictures. I've got all photos of all the main characters involved, and so you can see my talk, Sex and Drugs and Therapy, there. And then if you want a sort of more comprehensive read, fantastic book, maybe people have read, How to Change Your Mind by Michael Pollan, in which he talks about what a lot of people are calling the psychedelic renaissance. Yeah. Post-COVID, Greg Madison in conversation. I don't know if that's still on the SCAT website. Greg Madison in conversation with Ernesto Spinelli. That's a really good chat about being a therapist in COVID and beyond. Then, digitalization of services, all that's being talked about as there's this link you can find later, and also Liz Cotton, fantastic, and she's talking about the Uberization of counselling and psychotherapy. And then there's a paper here if you're kind of wanting to look at sort of how it's all being digitalized and so forth. But there's definitely AIs coming in. The first chatbot modeled on person-centered therapy, created in 1966. Programmed to sound like a Rogerian psychotherapist. Now we've got something called Wobot. I've got no personal experience of this, but this could happen, and I think very importantly the future, obviously what we research, I think quantitative, I would do being like sort of anti-Newton, but I think quantitative research is overvalued and qualitative research is undervalued. What Manu Bazzano calls quantitative imperialism, and obsessive measurement disorder. But qualitative research is gradually gaining more credibility from the 1990s onwards. Dennis Postel is someone who argues for our ordinary wisdom and power. So 3/4 of us never need mental health services. He says, what is it they know and do that keeps them so savvy? The Psy Commons examines the ordinary wisdom and shared power hidden from us by the mental illness industries and the medicalization of ordinary human distress. So he's got a video up on YouTube that's worth a lot, and lots of videos actually. He's a filmmaker. And those are my references. Okay, I managed to fit that into 15 minutes. Amazing. Sorry if it was a bit too late. I'm going to stop the share, and then everyone can unmic. Can you unmic?
Wow.
Do people want to go off for 5 to 10 minutes and then come back, or should we just go straight through to? It's up to you. Do we have another vote? Who wants a 5 to 10 minute break? Or who wants to just get on with
the 5 minute?
Maybe because I was going to. Is there stuff in the chat room? I'll look at the chat room for 5 minutes, okay?
Okay.
And then so we're back at 12:40, and then we've got 20 minutes of chat. Yeah.
Okay.
Brilliant.
Thank you, Jay.
Thank you, Jay. That was absolutely superb.
Okay, great. I'm glad you like it. I'm gonna read this. Okay. I'll just. I'm gonna stop the video just while I read it. Okay.
Hi, Katie.
Hi, how are you doing?
Okay, yeah. Have you started your job with the NHS, or have you just?
It's next week, but I did something like it for them in my placement at university.
Ah, okay. What was that?
Well, it's interesting because it's actually psychotherapy service, so it is talk therapy, not a CBT model.
Oh, brilliant.
Yeah, so it's for the staff. And they use EDMR. If you go on the team, they pay for your EDMR course. So that is something you tend to do if you're working with trauma. But apart from that, it's very much a traditional talking therapy service that we deliver to the staff.
Oh, okay. How did you get that placement then? What?
Luck.
How did you find out about it?
I rung up and asked. I kind of saw it, rung up and asked, and it was the first phone call I made. So I was just incredibly lucky. And, you know, just being lucky again, I kept in touch with people and so on. So they said, we need a bank therapist. Please come and join us.
So was it an advertised position?
No.
Oh, wow. You're proactive.
Yeah. So, yeah. No, I've got one guaranteed day and hopefully 2 guaranteed days. But we also do things like go out to the staff and do workshops on stress management, debriefing after trauma. So there's a kind of well-being aspect to it as well, and kind of designing lots of information, paperwork and things to give out to people. But, yeah.
Yeah, there's quite a good culture. I work in the NHS in an office job, and there's quite a good culture for supporting staff members and a lot of encouragement to seek help if they need it.
Yeah, well, it's an interesting mix because it's also a bit of a hierarchy. So in terms of class, the NHS itself is kind of a world within itself, and it has its own hierarchies. So there can be a lot of bullying, infighting, and, you know, things like humiliation and so on, because I don't talk to you because you're wearing that uniform, and I don't talk to you because you're far superior to me. And then, of course, I work with people from porters right up to the consultants. So there's lots of stuff like immigration issues, racial identity, a lot of gay members of staff from the gay community, and boarding school syndrome is quite prevalent, obviously, with consultants.
That's
so,
interesting.
you know, where they've focused on their careers so much that emotionally a bit stunted and have been rather abandoned emotionally.
Yeah, that's typical boarding school stuff, that is.
Yeah. So I love it. Yeah. And it isn't that set nice. I did REBT diploma, REBT/CBT. Interestingly, Wendy Dryden said IAPT stands for it ain't proper therapy. They've turned it into something it shouldn't be, and so on. So, which is an interesting take on it.
Yeah.
Now.
I mean, Wendy Dryden, you know, one of the kind of original sort of proselytizers for CBT and REBT. And if he doesn't approve of it, you know, that's saying something. Yeah. Can I just say something to kick off the discussion in terms of like answering or not being able to answer the questions that were in the chat box? Ian talking about reduced fees and private practice. I mean, I think you find your value in private practice, and I think some people seem to get paid hardly anything by EPs. That's not my experience. It's not great, but it's not bad. And certainly, I think the turning point in my career, I was that close to actually joining Mind and becoming a mental health advocate. But luckily, I got onto the bank of East Sussex County Council, and they were basically sending me as many clients as I could deal with. So then I changed my mind and then became a therapist. So basically EAPs, or the ESC, East Sussex County Council, you know, workplace counselling, is kind of what saved my career as a therapist.
Right.
Then in terms of Kate, I didn't quite understand what Katie meant about return show and not show and stuff. Sure.
Oh yeah, no, it was really badly written. Sorry, I'm a bit, well,
Yeah.
quite dyslexic, so it's
Yeah, but can you explain that in a minute, maybe?
Yeah.
Yeah.
Okay.
Yeah. And then the counsellors and psychotherapists, BACP members. What's the proportion of counsellors and I don't know, but worth finding out. I'm okay with EAPs myself. I know a lot of people put them down. But I'm okay with the ones I work with. I can only speak for them, especially Bupa. You know, see, this is like, on one level, you know, this is, you know, that's not, you know, I'm into capitalist medicine, I suppose, but on another level, Bupa leave me alone. They pay me to do therapy. All I have to do is send them the bill. I don't have to submit them case notes or anything. I'm allowed to be a professional. So Bupa is great for me as a practitioner, anyway. Well, how much do private practitioners rely on EAPs? I don't know. I would say I rely on them. I'd say 50%. Why is BACP moving towards counsellors? I'm not sure that they are. That may not make sense. It's just, I know that they're trying to, my sense is they are okay. They see there's a compromise. Back in the day, Sally Aldridge and the BACP wouldn't accept that there was a difference between counselling and psychotherapy. And the last time with SR, that was one of the things it fell on. But now it seems to me that they're ready to kind of say, yes, there is, and psychotherapists, you can have higher status. So anyway, that's the questions that I got there. But yeah, Katie, I didn't know what you meant by return.
Oh yeah, of course. Yeah. No, it was just that a lot of clients that have gone for CBT with the NHS model and, you know, some of the other places that are delivering it have been told that they're not allowed to come back. You know, after they've had just 5-6 sessions, they're told they're not allowed to come back to have more. And the reason being is that if they come back and have more, then because they're very carefully auditing this, it had been shown that there were a lot of returns. So they got rid of that. So they didn't allow anyone to return. But the other thing was they were also saying to these people, basically, you failed at counselling. You know, we've given you counselling, we've given you the 6 sessions. It's clearly your fault, your problem. You're not motivated enough and you don't want to do it. And that's the issue, you know. So I'm sorry, counselling is no good for a person like you.
Because you can't finish in 6 sessions. That's mad. And this is like where EAPs are quite, I work for one EAP now, which has actually got quite a great system. They basically do it in sessions of 6, and every 4 sessions of the 6, you do a progress report. And if in that progress report, you as the clinician and the client want more sessions, you put in a request. So, I mean, so far I've only taken that up to 12 sessions, but I am allowed to take that up to 18, 24. You know, it has to be approved, you know, but there's a progress report every 4 sessions of the 6. Yeah.
I had cancer and we were allowed 6 counselling sessions. And that was it. And it was just that feeling, I failed. You know, you had 6, you couldn't come back, you couldn't, you know, ask or have any reconnection at all. That was it. You're 6. You're up, you're finished, you're done.
You know, this is almost unethical, you see, and so, like, you know, the BACP should maybe be campaigning on these kind of issues rather than trying to sort of just fit into the model. You know, and there are other models. Like, so for instance, you know, like I say, this is an EAP model. Yeah. So why can't the NHS have that kind of model? Also with Bupa, the clients, they basically get to look at a directory and then they choose which therapist they want to work for based on their biography. You know, why can't the NHS have that? You know, so it's not like their model is the only feasible model for a health service. It's the model they've chosen to have.
It's not universal though. I've been doing some work with NHS clients recently in Haywards Heath.
Yeah.
Some funding was available and I received several clients for 6 sessions, 2 of whom have subsequently gone back to their GPs and said, I want another 6, and they've been given them. So I don't know, I think there's slightly more enlightened administration at the...
Well, it might be the doctors who are more enlightened, recognising that they need more rather than the administration.
I think post-COVID, well, post, we don't know, but there seems to have been a bit of a shift. I think, you know, to be optimistic, I think they're beginning to take mental health a lot more seriously. I think, you know, there are more EAPs, they're more, you know, they've certainly relaxed a bit, so they're not demanding accreditation now, just that you are registered and you are, you know, so on. But yeah, I think they've realized that mental health is a very serious business now, and they can't just fix it with CBT. And, you know, what has come out of this pandemic is not just lots of deaths, but lots of breakdowns and, you know, basically breakdowns in families, breakdowns in society. You know, there's kind of wanted to work us as kind of cogs in a machine, but, you know, it's not helpful for the machine. So now they're trying to give us, they're investing a bit more. So I think that is positive. I mean,
The other positives of it is that lawyers have made a lot of money too. It's the other positive side.
Yeah.
Divorce lawyers, that is. Jay, we've said this before when I came on your sex and drugs thing, which was great. But CBT is not for everybody. No. You know, the idea, some people can't handle CBT.
Yeah, I mean, like I said in a kind of social media conversation, Mick Cooper, I think it was in a personal correspondence when I was doing my PhD, but he said CBT is neither the solution nor the problem. Yeah, I think I kind of, you know, when people start sort of CBT bashing, I'm not that, you know, I use CBT myself, you know, especially in EAP work, and I think it's also how you use it. I mean, the way that I use it, I can actually get to the, if you like, the core undefended feeling behind the other feelings quite quickly with CBT, the way that I do it. You know, maybe other people don't do it as well. I mean, but I'm not.
I use CCBT. I use CCBT, which is client-centered cognitive behavior therapy.
Okay. Yeah. Well, I mean, you see, CBT. They often said that the relationship is foundational. Anyway, they're quite into Rogers and his core conditions. It's just that they want to sort of put techniques on top of it, you know. But I'm not a CBT basher, but I'm definitely against the dominance of it in the NHS and the fact that people don't have a choice. Yeah.
It's applying techniques to people. And I think, you know, I've worked in social care for 18 years, and we've always used person-centered approach with the guys that we support, in the sense that, you know, what do you want? What's meaningful to you? So it's very existential. What do you like doing? What, you know, how can you contribute to your own life? How can you best make choices? So coming from that hardcore model into counselling, I'm very surprised that they're using all this kind of technique stuff, whereas in social care, they really value the importance of person-centered, which means tailoring things to the client who's presenting with you, being able to kind of, you know, keep pace with them and, you know, think about what they might need rather than doing stuff to them.
Yeah, absolutely. Yeah.
Jay, can I mention a couple of things from your talk? One was you mentioned about Greg and his interview. It's a pity you weren't able to all open up my report about it, because I did say that one of the ones that we did for CBT, for counselling, was what really matters, and that was Greg and Spinelli doing that. And he very kindly, and he's there, so I'm not just being sycophantic. Well, I am, sorry. He gave it completely free to SCAP and to every single member. And it was a wonderful, wonderful, wonderful experience listening to them, and the times I've, you know, thought about it, what really matters, and hearing all that stuff you said, you know, and I'm very interested, but I did shoot back to transaction analysis. And I remembered when I first came across that, I remember the tutor saying, Burns wrote this so that 7-year-olds could understand it. And along came the academics and ruined it. And that's, you know, that's from the 60s, 70s. And, you know, I was a little bit along those lines again. You know, what really matters, you know, when you're talking about the future and, you know, all the different groups. And I also wanted to say, I actually thought I'd sent it on a message, but when you were talking about, you know, learning from our mistakes, I think we need to celebrate learning from our successes as well.
Yeah, yeah.
Ended.
Yes, I mean, it's been politicized. Well, you know, that's part of the professional project. You know, it's going to get politicized because people want to pin down what it is, you know, and make it less of a process and try and sort of get it to keep still long enough to say that's what it is, you know. And then things like, yeah, when I was doing my research, one of my interviewees, you know, she was sort of harking back to the beginnings of therapy training. And she said, you know, I started when doing a training, you did it in someone's front room. Yeah. That's kind of true. Yeah. And now, yes, it has been, well, it was taken over by the universities. And then as soon as you get into the universities, then you kind of have, you know, then you kind of have the fight of should it be, well, like I was saying at the beginning, should counsellors and psychotherapists be trained or educated, or a bit of both? Yeah.
Yeah, that was an interesting distinction, which I'd never actually considered. That was interesting.
Yeah, and how much free reign should we have? You know, I mean, see, I'm with Yalom that every, you know, that basically you have a new therapy for each and every new client. So in that case, you can't have standards or regulations, yeah, because it's never standard, never regular. I mean, like, I remember when I went for a job interview out at University of Brighton, David Bott on the panel, and some other, Pam Howard, you know, and he said, you know, so what's your, you know, how do you practice therapy? And I hadn't, or words to that effect. You know, but he helped me because I got a bit stomach. Oh, well, you know, humans. He said, "Oh, it sounds like you do J therapy then." Yeah. And I think, like after you've been, maybe when you first qualify, you think that you're a CBT practitioner or a person-centered therapist. But I think when you've been practicing for 10, 15, 20 years, you kind of realize you do it your own way. You know, you might sort of say, "I'm humanistic" as a kind of shorthand for other people, but actually you're doing it your own way by then.
Well, I've been doing it for 50 years, so I'm certainly.
Well, let's hope you're doing it. Yeah, I imagine you do
some things right. And for those of you who saw different strokes for different folks, that was very much about, you know, the very different approaches you need for different people, and lots and little bits of ones in this with the same person, you know. And that was Google making that film, which for you older people will remember Gloria as part of the training, and it was to replace Gloria in terms of people watching, you know, physically. Because my big moan is that so many of these courses, they don't work enough on the practical skills of people.
Jeannie, yeah, did you say there was a film to replace
I made a film. Well, Google made a film some time back, and
Gogglebox.
Not Google. Do you know, I described Dwight Turner as Delight Turner. So, you know, thank you for that. Thank you for correcting me. I do natural speaking though as well, you see. I use natural speaking. I have done for 25 years. So sometimes words that come out that they're quite well, sometimes they're very rude as well. Yes, it's different strokes for different folks, Charles. And it's just showing, I worked with 5 different people on 5 different issues. I sent it to Greg, actually. Greg will remember my sending, because I just wanted, you know, a professional person like Greg to say, you know, is this valid or useful at this stage? And one was a sex issue, one was counselling, one was multicultural. It was a girl, a Caribbean girl, you know, so it was quite interesting to see that cultural issue there as well. and it was just showing different types. It was showing Gestalt, TA, Rogers, and CBT, and and it was different strokes for different folks. And the other two films, one was Their Story Not Yours, that was just Rogerian, and the other one was Pitfalls in Counselling. And a number of universities have kind of bought that as a kind of introduction to counselling courses. It's a kind of, do you remember the John Cleese, some of you older people, meetings, bloody meetings. By the article, it's like along those lines. It was a send up really, but it was quite funny. But it was really at the same time saying, you don't do this, this, and this.
I'm noticing the time. We've spun round on time. So thank you so much, Jay. I've been scribbling away with my notepad. I'd quite like to see your slides, if that's.
Yeah, if anyone wants the slides, my email. I'll just put up my email address in the chat room. It's basically j.beichman@gmail.com. So if you want the slides, just send me an email and I'll send them back via email.
Well,
okay?
yeah.
And also, it's going to be online soon, isn't it? I mean, it's going to be a Sussex Counselling.
Yes, I'm going to send this to Adrian, and he's going to cut off the AGM bit and put your soup up your bit, Jay, and it'll be on the website as a resource for our members, so we'll be able to log in and see that. So.
I've just written to Adrian to say, will you please send everybody the notes again, because nobody could open them at all, apart from you and Katie and Ian, who I sent them directly to when I wrote my report.
Yeah, brilliant. Yeah, I will post the documents on. I think they'll have to be posted on the website somehow. We'll sort that out. Thank you so much for coming, and hope you enjoy the rest of the day.
Yep. Now, you're all coming to Dwight. Put your hands up. Are you coming to Dwight's? Put your hands up. Coming to Dwight's. Everybody.
I'm at a festival
that day.
Sorry, Babs?
I hope so. If I'm not moving house that weekend,
oh, wow. Oh, okay. Be good to see you. Yeah, well, so that's good. That's a few extra there. So push it out to all your contacts. Let everybody know.
Please.
Okay. Bye-bye, everybody.
Well done, Sheila. Bye-bye.
Thank you.
Thanks, Jay.
Have a wonderful rest of your life.
Yeah.
Bye.
Bye.